the Physical Health Committee decided to take on the metabolic syndrome. And you see in your in our little brochure we talked about what is the metabolic syndrome. And we talked about it, that it's a devastating health issue in San Francisco that concerns Black people. And it predisposes us to heart disease, stroke, and diabetes. And the metabolic syndrome is when several conditions occur together, including obesity, diabetes, high blood pressure, and high lipids.
So Emma has spoken to the medical conditions that relate to the stroke, the diabetes, the high blood pressure, the hypertension. All of those elements together create this additional risk for many of the citizens in our neighborhoods. And in fact, the only neighborhood that was not number one was the number one issue was violence. It slipped down to number 2 in that neighborhood. So across all of our neighborhoods, that's predominant. We've looked at all of the studies, and you can see across the various neighborhoods, in Bayview, violence is number 1. However, ischemic heart condition is number 2. And in the other neighborhoods, it's stroke, heart condition, stroke, heart condition, lung cancer. It goes down to number 3 in some neighborhoods. So you can see across all of the neighborhoods, there is this predominance of grouping all of those risks together we call metabolic syndrome. And so we've said we need to address this in study, and we did some research, to look at what the practices are in the medical community. And what we found were gaps in the way that diagnosis was done, treatment was done, follow-up to treatment was done. And we said, we don't like that. That's not the way that treatment, diagnosis, and follow-up is done among other communities. So we want to change the standard of care that doctors, hospitals, and clinics will be using to educate our citizens around what are the ways to prevent metabolic syndrome. We want the hospitals, doctors, and clinics to change the way they assess and diagnose, the criteria they use to determine if our patient is a metabolic syndrome risk, to provide a different way of addressing treatment and follow-up. And so our recommendations then tie into that. We want to change those things, and to the point that we have said we want to ask the medical community to help us put together a pilot project in which all of our recommendations will be implemented. And we want to make sure that the community sees that these more aggressive criteria for diagnosis, the more compromised criteria and treatment and follow-up that's used will make a difference among African Americans. Those are our recommendations.